Good evening, all. Welcome to Light It Red podcast series, a joint initiative by Natco and Voice of Healthcare team. Light It Red, it's a podcast platform dedicated to spreading awareness, sharing stories, and bringing hope to everyone who have impacted with blood cancer. I think you all know every year millions of people around the world or in India also, if you take diagnosed with different conditions like leukemia, lymphoma, and myeloma, yet too often signs and symptoms are ignored, quite often ignored. So today we have Dr. Sridhar Gopal, a renowned hemato-oncologist and stem cell transplant physician from Sri Ramakrishna Hospital, Coimbatore, to understand and explore what blood cancer really means, and he'll also share his knowledge and expertise into this, and also why he's with us as we explore how multidisciplinary care and clinical research and the treatment is evolving in the coming future of the blood cancer. Thank you, sir. Always honored to welcome you in this particular Light It Red platform, sir. Over to you.
Thank you. Thanks for the nice introduction. Again, it's thank you, Natco, for organizing this event. And it's my privilege to be a part of this awareness initiative to public forum. So basically, again, as you all aware, blood cancer is like it's considered as a myth in most of the times. So many times people think that once the patient is diagnosed with blood cancer, this is like all done. Nothing could be done, kind of. But nowadays, things have changed. In the recent past, especially in the last decade or so, we have excellent researches, excellent molecules, excellent drugs which are available for blood cancer. So now the cure rate is almost nearing 90% odd, depending upon the type of scenario, depending upon the type of cancer. Again, I'll be happy to be part of this forum, to which I can share a few insights of what you asked. Yeah, thank you, man.
Thank you, sir. It is always honored. And as this month is recognized as September as Blood Cancer Awareness Month, so going into
month, yes.
general audience questions and what are the myths. So when we talk about the basics and awareness kind of thing, actually, what is blood cancer, sir? How does it differ from other types of cancer?
Again, for the basis of understanding for all the audience who are watching. So in blood, we call it as a 3 cell. What we call as one is RBC, the WBC, and the platelets. So each and every cell will have its own function. Like RBC is nothing but a hemoglobin, what we call as a general. So the RBC is a cell which generally carries the oxygen, whatever we inhale, and it will be in circulation. So any deviation in the hemoglobin levels, say the normal hemoglobin levels for males, it's from 12.5 to 16.5, and female it's around 12 to 16. So any deviation in the hemoglobin, whether it's high or low, could be a part of any disease, even including cancer. Again, next cell is a WBC. Again, WBC, if we call, it's a general term, we say it is a termed as a police protection of the body. That means these WBCs are the cells which generally prevents or protects us from multiple infections. Say it's virus or bacteria or anything. So whenever, again, in the WBC, it has a normal range. So the range is between 4,000 to 10,000 odd cells. So again, in WBC, there are multiple other different types of cells like neutrophils, lymphocytes, basophils, and eosinophils, monocytes. So each and every cell will have its own function. Again, for platelets, if we say the platelets counts are the counts which helps us in stop the bleeding. So again, the normal platelet counts are ranging from 1.5 to 4 lakhs. Again, any deviation from the normal, what we call, could be a type of any sort of disorders, including cancers. So why I'm saying this is, so blood cancer is nothing but any deviation in any of the cells. Sometimes, even though we say the normal counts of WBC ranges between 4,000 to 10,000, sometimes we do see patients with the 5 lakh counts. The WBC can reach up to 5 lakhs, even 6 lakhs, even 8 lakhs. So when there is a deviation, then we can call it as a blood cancer. Similarly, the platelet counts, it can go up, even it can go low. We have seen, even today, we have seen a patient with the platelet counts of 1,000. We all know the normal platelet count is somewhere around 1.5 lakhs. So all these are basically blood-related things, what we call it as blood cancers. Whereas in solid cancers, like could be any tumor or a growth. See, example, breast cancer, there will be a lump or which is a what we call as tumor. So in blood cancer, there won't be any tumor. All these are liquid component. So that's what the difference. What I can say. But again, many a times we have to do a blood test to diagnose the blood cancer, to test the number of cells, and then we will diagnose accordingly.
Okay. So any deviation in the count or the number, be it WBC, be it RBC or lymphatic region, then it is blood cancer.
Could be.
Okay, sir.
Yeah,
Yeah,
that's
could be.
what I'm not saying all of blood cancers. That's what, again, there are many things here. So again, the blood cancers per se will have lots of things to be addressed. Like just because the hemoglobin low, we cannot call them as a blood cancer patient. It could be a simple anemia. It could be a simple iron deficiency anemia, which is very common in India. Because in India, the only thing which is very common among the blood-related disorders is anemia. Again, out of anemia, iron deficiencies cost around somewhere 70 to 80 percentage of patients will be iron deficiency. So just because the hemoglobin low, some patients will be sitting with a hemoglobin of 3 or 4 with us. So normal hemoglobin is somewhere around 12, but still it will be symptomatic for that. We cannot call them as blood cancer straight away.
Blood disorder. Okay, sir. Understood.
So
It's
yes,
very
blood disorder. Yes. So after of the all blood disorders, blood cancer is a part of it. It needs to
okay.
be addressed. It needs to be few more tests which has to be done to call them as the blood cancer patient.
Okay. Sir. And when you talk about the types, sir, what are the types of this blood cancer? Main
Yeah.
types.
Say blood cancer major types. What we call it as leukemias, lymphomas, and myelomas in general. So all these are derived from, like, as I was saying about WBC, is that because all these cells will be a deviation from the WBC. Okay, so again, if you see the leukemias, again, all these will be there. When the WBC counts is too high. Say I was saying, it can be up to the cells can go up to again lakh or so. So in that way, WBC counts will be high in leukemias. Whereas lymphomas, again, these are also a type of WBCs, but it's predominantly present in the lymphatic system. Say, example, we do everyone would have had some sort of tonsils in the younger age group. No? So all these are lymph nodes which are present all over the body. So sometimes this will get enlarged, so resulting in the lymphomas. Commonly, we can come across some lymph nodes or swelling in the neck region, sometimes in the armpit or axillary region, sometimes in the inguinal region. So these are the areas where the lymph nodes will be easily accessible, and the lymphomas will be present in such a way. Whereas myelomas, basically, it's a disease of elderly. More generally, it is present more than 6 years of age, and this usually present as a chronic back pain. So we again, maybe 5 out of 10 patients will be having back pain, but not all back pains are myeloma. So again, for myeloma, usually there will be a bony erosions, like the bones will get eroded over a period of time, maybe because of the age also, but again sometimes because of disease per se, and subsequently this results in like malaise, where the patient will be very much tired, and sometimes some patient can have some renal problem, some patient can have some constipation problem. So all these constitutes a disease called as myeloma. So if you see blood cancers, predominantly it's categorized as major three types. There is a leukemias, lymphomas, and myelomas.
Okay. Sir. Okay. Sir, is there any age standardization or what are the risks of this developing blood cancer, sir? Risk factors
Again,
when we talk
risk is, say again, we generally say that the leukemias, especially the ALL type, is much common in pediatric age group. So most of the patients with leukemia, if you see, again, it will be a very younger age, less than 10 years of age. Whereas yeah, other type of leukemia like AML, in the elderly age group, it will be generally affecting patients more than 50, 60 years of age. Again, as I was saying about myeloma, it again will be elderly, again 60, more than 60 to 50 to 60 years of age. So these are the age categories of different leukemias and maybe blood cancers. Again, there is not much of a gender discrimination or something like that. So any patients can be affected, any age group can be affected. Again, even though we see commonly the ALLs in the pediatric means, younger age group people, but again, on the contrary, we will see some patients with 80 years also. So even though we say it is most common in this age group, but doesn't mean that it will always stick on to that. So we have seen AMLs in 3 years, 4 years also, but it's much generally common in 60 years of age. That's what. But
Okay.
generally, it can happen. See, basic dictum is that there's not much of a risk factors for blood cancers. Say we all know that smoking will increase the lung cancer. Maybe excessive alcohol increase the chances of liver cancer. But to be true, blood cancer does not have any such risk factors at all. Uh, so it's most of the time it is like it's a genetic mutation based. These mutations generally can happen to anyone at any point of time. Even I will commonly say to my patient that these blood cancers generally are not identifiable unless we do a blood test. So many times the patient gets symptomatic and then we will present to us. It's not that much of a preventable kind of as far as blood cancer is concerned. Whereas other cancers is preventable, like say lung cancer. Generally, it is predominantly smoking induced. So by avoiding smoking or avoiding air pollution, maybe use all these things can prevent some sort of lung cancer. Whereas blood cancers, we don't have such kind of preventable factors.
Okay. And to understand the burden, sir, mean to say, when we talk about the incidence, which type of blood cancer are common in India, sir? Very
Um,
common.
again, see, leukemias are generally considered common. Again, so out of all the blood cancers, out of all the cancers, the blood cancers will be somewhere around maybe around 6 to 10%. What we can say. Again, again, it is equally dispersed. Like some patients, like again, it's leukemias, lymphomas, myelomas are all almost close, like equally matched kind of. But general blood
Okay.
cancers contribute 10 up to 6 to 10% of overall cancer percentage.
Okay. Sir, is there any warning signs or alarming signs or symptoms that people should know, be aware of this for blood cancer? Any signs and
Yeah.
symptoms?
Yes, of course, people should be much aware. Yes, yes, exactly. Again, initial part I have said about what are the cells types, no? RBCs, WBCs, and platelets. The reason why I have said this, basically, the symptoms will be pertaining to that cells. Example,
Oh,
if the patient is like even the hemoglobin is too low, okay, so the patient will develop anemic symptoms. Sometimes it will be very malaise. That means the patient will be very tired. I feel of the sense of well-being won't be there. He will be extremely lethargic, even to walk, even to talk. Sometimes some patient will get dyspnea, that is difficult in breathing, even by walking few steps or so. They cannot climb the steps. Sometimes some patient can have pedalema. That means all these lower limbs will get swelling, abdominal pain, abdominal distension. All these can happen when the hemoglobin is too low. So these can be symptoms for the cancer as well. Again, some patients, when the platelet counts are too low, again that's called as thrombocytopenia. They can have some bleeding manifestations. Especially some patients can have a bruise or a petechia. That means mosquito bite-like spots, which can present all over the body. Um, so these are the manifestations when the platelet counts are too low. When the WBC counts are high, again, there can be some lymph nodes, which I was saying. No, there can be swollen lymph nodes, especially in the cervical, there's a neck region, or in the axillary region, or the inguinal region. So some patients will have severe bone pain. So these are just again, all these are non-specific signs and symptoms, which is common in blood cancer. It's not like other part of cancers. Like if the patient have breast cancer, the breast will be getting enlarged. If the patients having lung cancer, will be having chronic cough, will be spitting blood. But it is vice versa. It's not possible in blood cancer. It's a generalized, non-specific symptoms. Even a generalized malaise, just tiredness could be a symptom of cancer. Even the bone pain, which is much more common, could be back pain, could also be a signs of cancer.
sir,
So the
anyways,
reason
you
is
talked
not
about.
to make apprehensive. The reason is not to make apprehensive, like kind of. I'm saying what I was trying to say is that bone blood cancer generally non-specific, not much of symptoms. But one thing is
Yes,
sure, any patient who generally the blood
blood.
cancer patients, especially leukemia patients, they can't sustain before reaching hospital. Like if within a 2 weeks or 3 weeks span from the origin of symptoms, the patient will get admitted somewhere in the hospital. That's what the leukemia is all about. It's extremely fast-growing cells. So they will be symptomatic only for a very short span of 2 weeks time, even sometimes less than a week or so.
Okay. Sir, when we talk about the diagnosis, anyways, you were discussing about the count, the number, deviation, complete blood picture, test, blood
Hmm.
test, everything. So,
Yes, yes.
what are the other common methods of detecting blood cancers?
See, again, the first thing of detecting blood cancer is do a complete blood count, what we call CBC, or complete hemogram. That will show, basically, that will say all these blood-related things, especially the hemoglobin level, the WBC
Hmm.
count, and the
Yes, yes.
differentials. What I was saying, no, lymphocytes, neutrophils, monocytes, basophils, and eosinophils, and the platelet count. So these three things, if it is normal, again, close to maybe 80% of the patients may not have much of a problem, even blood cancer. Any deviation, especially leukemias, the WBC counts can go very up, the platelet counts can go very low. There are some other disorders called as MPN, that is myeloproliferative neoplasm, where the platelet counts can go up. It can go up to 10 lakh, 20 lakh also. Again, the hemoglobin can go up to 23, 24, but the normal range is somewhere around 16.5 for male. So again, any deviation in this can be easily picked up just by doing a simple complete blood count, which hardly costs 200 rupees.
Yeah. Sir,
But again,
unlike
that
in
alone is not sufficient.
okay,
Yeah, we have to do multiple other tests. So just when the hemoglobin is high or low, when the WBC count is high or low, we will do further testings like other peripheral smear, a simple CBC and a peripheral smear, which hardly costs 500 rupees. Okay, will at least clinch the majority of blood cancers, what I can say.
okay, okay. Sir. Unlike solid tumors, when we were discussing about solid other cancer or organ-related breast cancer is confined to. So those, for example, in their family history, if they found to be a someone is from having a solid type of cancer
Yes,
tumor,
yes, yes. Hmm.
so the recommendations definitely will be different in solid tumors. Sir. But if the same thing
Solid tumors,
in
yes.
solid tumor, but when we come back to blood cancers, if any of the family member is affected with blood cancer, in those family, what could be the other screening recommend? Is there any screening recommendations, sir, for those set of things?
Yeah,
Unlike
again, see, again, I said no, blood cancers, all these are, even though they are genetic mutation based, majority of the
hmm,
cancer are because of genetic mutations, but still, all these are somatic mutation, what we call say. Somatic means it can happen over a period of time. It need not
hmm,
be inherited. Only certain cases, like there are certain diseases, especially like kind of AML, where there can be some genetic, especially in the pediatric population. There could be some variation in the genetic mutations, like a TP53 mutation, which can happen
hmm,
especially in the younger age group, especially in the pediatric age group. But as the age advances, all these tend to change. All these are somatic mutations. Again, this can happen to anyone. So the patients, see, if the patient has a positive family history of blood cancer, what we would say is as long as the patient is comfortable, we not worry about that. We generally
hmm,
ask them to tend to take a blood test maybe every period of 1 year or so. Just check the counts alone and examine maybe once or so, like to look for notes, just give some general awareness regarding what kind of blood cancer can happen, what are the symptoms of blood cancer, and when to come to a healthcare worker in that way. So
okay,
generally, there is not much of a screening required for any patients with a family history of blood cancer.
okay, sir.
Apart from
Okay.
very there are some exceptions as well, but as a
Hmm.
general forum, this is fine.
And coming to the crucial part of our discussion, sir, that is treatment and innovations. When we talk about treatment and innovations, how does this treatment landscape have been
Yeah.
evolved if you take last decade for blood cancers?
Yeah, definitely it is. I would say it is extremely evolved. It's an era for
Hmm.
the treatment for blood cancer, I would say, because especially the last decade or so, we have seen maybe exceptional works, exceptional researchers in getting newer drugs, newer molecules for chemotherapy. And previously, there used to be eras where I would say maybe in 1990s, 2000, when the patient is diagnosed with blood cancer, we hardly have some maybe 3 to 5 drugs, hardly, I would say. So after that, we don't have much of a drugs to offer for the patients. But nowadays, there are a good number of medicines which are even many drugs are economically like affordable also. Many have become generic. So in that way, there are newer advances, newer therapies which are much more economical, much more but like much more better side effect profile. That means the patient can tolerate the chemotherapy in a very easy way. Again, especially in the last decade or so, previously AMLs, what is called as acute myeloid leukemia, is a very dreadful kind of blood cancer, what I would say, because elderly people usually affects the elderly people, where maybe 10 years or so there was not much of the medicines available. Transplant was the only option you could. But nowadays we have one injection under one tablet form, which is not much gives an economic burden to the patient, but it is easily approachable. The patient can easily tolerate, not much of a complication. So now the lifestyle is again, it even maintains a lifestyle, good quality of life for the patient. That means the patient can take drug, he can go, he can be a normal people like others as well. So again, there are other innovations like immunotherapy, where we will try to target, apart from chemotherapy, there's something called immunotherapy. That means this will be target specific. That means there are some antigens, maybe the cancer causing cells, antigens over the cancer cells. So our drug will directly affect only the target cells alone. So it won't affect elsewhere. In that way, it will prevent, again, it will reduce the side effects for the patient. So there are multiple other innovations as far as blood cancer is concerned. Especially this last 10 years or so, we have seen excellent uh, immunotherapies, chemotherapies regimen for most of our patients. That way, again, the survival rate of blood cancers increased quite significantly in the recent past.
Okay, sir. And coming, discussing about this treatment, when you talk about, can you throw some light on bone marrow transplantation also, sir, in India, how it
Yeah,
is
yeah,
evolving?
for sure, yes. Again, bone. What I just say a glimpse of what is bone marrow transplant. As I was discussing all these time, the blood
Mm.
cancers are nothing but which it is produced by our bone marrow. So bone marrow is nothing but the long bones, especially for an adult. That means if you there will be a bone inside the bone. There is something called as a bone marrow, which is a spongy like tissue, which generally produces all the cells. So all these blood cancers will be produced from the bone marrow per se. That means there is a problem. There's a mutation which happened inside. This results in the production of the cells via the bone marrow. Okay, so these bone marrow tend to produce a humpty number of cells.
Mm.
So bone marrow transplant is therapy where, because the bone marrow is getting affected, it is being producing the bad cells. So we will try to replace the diseased marrow with a normal one. That's what. So example, if for the kidney transplant, we will try to take the kidney, diseased kidney out and will replace the normal kidney, right? Similar to that, but it is not a surgical transplant. It is a medical transplant. That means there is no surgery here. So we will try to collect a stem cell from a donor. Most likely, most of the time it will be from a family donor, from a brother, sister, father, mother. And then we will try to match with the patient. Like we will do something called HLA matching. Once HLA matching is done, we will collect the stem cell from the donor and then we will inject. That is similar to the blood transfusion, like through the
Mm.
same vein, we can transfuse the stem cells. And then these stem cells will go to the patient's. After that, after collecting stem cell, we will do something called as um, but we will try to eradicate all the cancer cells. Um,
Mm.
so after that, we will these stem cells, what is collected from the donor, will go inside the patient's cell, and then will start producing normal cells. This is the basis of transplant. So again, now the transplant is enormously evolved. Like now, many of the patients, many of the blood diseases, blood cancers, the transplant options available, and we are working with transplant.
Okay, sir. Sir, any this CAR T-cell therapy also nowadays we can see
Yeah, yeah, CAR-T,
how
yes,
much is good
again.
for Indian patients, sir? Mm.
Yeah, again, it's there are recently again sir, recently from 3-4 years or so, the CAR-T is extremely evolving kind of. Again to give a basis of understanding of what is CAR-T. Again, as I was discussing about WBC, there are the different shells of WBC like
Mm.
neutrophils, lymphocytes, monocytes. In the lymphocytes, predominantly these are the cells. There are two types of lymphocytes. There is a T cell and B cell. The function of the T cells and B cell is to give some infections, like this one gives some protections to the infections. Like any virus, when it affects us, basically these T cells and B cells will recognize that virus and it will mount an immune response, resulting in the killing the virus. Similarly, some kind of cancer cells arise in our body. Again, these T cells will arise. Okay, we will try to mount the response, but it won't be strong enough. So what we are doing it here, we are taking the T cell out. We are priming the T cells to fight against the cancer, and then we are again giving back the T cells to the patient. In that way, we are training our own T cells to fight hard against the cancer. That's called as CAR T cell therapy. It's chimeric antigen receptor T cell therapy. Again, it's evolving now. We have seen good number of success in the recent year or so, and currently it's available for leukemias, lymphomas, even myelomas. It's even again, it's fastly evolving, what I would say. So it will become a future for sure.
Okay, sir. Sir, coming to the in Indian scenario, when we talk about affordability, it's a main crucial part because how often
Yeah,
this treatment, what
exactly.
you have explained, immunotherapy or BMT or that to CAR T cell and other targeted therapy kind of things, how often it is affordable to the patients? They are that is what sir, when you talk about affordability.
Yeah, see, again, India is still being a developing country. Again, there are some yes, definitely there are some financial constraints for sure. Um, Again, the treatment approaches wise, again, the finances wise, it varies for each and every cancers, I would say. Again, some cancers like maybe lymphomas and ALLs, basically it won't cost much. Again, it is maybe I would say, I mean, because it varies from patient to patient. Whereas if it goes to AML, the treatment definitely cost definitely goes up, and any transplants will be costing much more. So nowadays, there are many schemes which are available from government side, especially that Ayushman Bharat. Some states like Tamil Nadu and West Bengal, Rajasthan, all these are helping a lot of patients who are hello. Am I audible? Am I audible?
Hello. No, yes,
Hello.
sir. Somewhat
Hi,
there is
Sandeep. Am I
disturbance.
audible?
Ah,
Yeah,
you are audible, sir.
some network issues, I guess. Yeah.
Network
Yeah,
issue.
yeah, yeah.
Yeah.
Again, so there are some various CM schemes like Chief Minister scheme, Prime Minister scheme. There are some CSI initiatives where they are giving they are nowadays we are able to do the transplant for free as well. Especially pediatric transplants for thalassemias is getting like we are able to finish it in free as well.
Oh, okay, sir. Uh, you
So
have explained about
definitely I would say the government is coming forward to help all the blood cancer patients. So we are having good number of schemes in both in central from the state government side for a certain set of blood cancers, and they are helping us in an enormous way.
okay. So you have discussed about affordability. Sir. Now the one more part is accessibility. So when a rural guy, from small town, how far accessibility of oncology center or BMT centers are there for that kind of tier two city patients from coming from small town?
Yes, definitely it has to improve. Okay, especially from tier two, tier three cities. What I would suggest is okay, because definitely the accessibility is much better in tier one cities. Again, we are able to get all the diagnosis in a span of maybe 1 or 2 days time. Whereas the same patients who are coming from tier two, tier three cities, the accessibility for all these the diagnosing technologies is much lesser. Still, it has to grow as well. So and especially from my side, what we will do generally, we will ask them to come as the patients to come here once at least to get the diagnosis. We will explain all the treatment options to them, at least for the initial period of chemotherapy where the patient has to be in close monitoring. especially during the induction phase of chemotherapy, we'll ask them to stay here. And once the patient is comfortable, there is not much of a complication, not much of a side effects to the drug, then we will ask them to give the medicines to the local place, and then we will ask them to continue over there. And we will ask their own primary physician to take care of them. We will get in contact with the primary physician so that the patient is in safe, like close monitoring as well.
Yeah. And so we have discussed about the burden. We have discussed. You have thrown some light on the treatment evolution, and accessibility, affordability. But still, blood cancer itself, the word itself, somewhere fear is created in the family. So when we talk about
that's what I'm saying. It is a myth. It's a myth again.
That's one. So this is that is.
So again, many times.
Please.
Yeah. See, to be true, even now, even saying a word of blood cancer, the patient will cry in front of us. Okay, there will be emotional outburst. Like the moment you, even before saying, some patient will obviously there will be some emotional instability for them. Still, the myth is there. So what I would say, definitely it needs lots and lots of awareness program. Our program, there are like our programs. So we have to have a good number of awareness campaigns for all the public to gain what is blood cancer. Again, definitely not all blood cancers are going to be like blood cancer is nothing but death. Not at all. So things have changed. There are the years of the world. So we are in the new era where we have good number of medicines to cure most of the blood cancers. Again, previously we never used a word called cure in blood cancer. Nowadays we are able to use a word called cure in blood cancer. That means many of the lymphomas we can give a cure. Many of the leukemias we can give a cure. Only in certain disease like myeloma, where it's controllable and not curable, what I will say. Still, it's manageable. Most of the patients with myeloma will be leading a normal life as everyone. So blood cancer is nothing, is equal to death, is no more.
Okay, sir. And one strong advice for all our audience, general audience, or who are listening to this podcast, one strong advice from your side.
Blood cancer is definitely curable. First and foremost is to diagnose the blood cancer, because many times it needs lots of expertise.
Sorry to interrupt you.
Yeah, please, Rahul.
Can you wrap up the session in 2 minutes, because we have lined up another session and all the doctors are waiting.
It's on final only. This is final.
Yeah.
So again, for all the general public here, blood cancer is definitely a curable thing. The thing is that we need to diagnose blood cancer at the earliest, because as early as the cancer detected and as early as the treatment is being started, that we can give a 100% cure for most of the patients, I would say. Okay, so the detection, earlier detection, with precision, with the faster treatment options, we can hit the cancer for sure. Definitely, blood cancer is a curable one. Again, last but not least, blood cancers, the patients are all various. It needs lots of emotional support for them, because getting chemotherapy for blood cancer is not easy at all. There will be lots of problems which can happen to them. But over a period of time, once this cancer, chemotherapy, everything is over, the patient can lead a normal life as anyone, like me, like you, and everyone. So all these part of time, short span of maybe around 1 month or so, they need lots of emotional support. So I would urge all the family members to stay strong with them, give some emotional support, and patient again be motivated and get some self-confidence. It's definitely could be done. It's treatable. Jai Hind.
Thank you, sir. Thanks nullifying the myths, throwing some light on blood cancer, treatment, everything, and your strong message also requires some emotional support. And also, last but not least, blood cancers are curable. Thank you, sir. Thank you very much.
Thank you. Thanks for this opportunity. Thank you, Anand.